On behalf of the House Democratic Caucus, I want to thank all the members of the media for being here, but more importantly, I want to thank the members of my caucus as well as the members of the community for joining us today. While I represent the Democratic Caucus as leader of the Democratic Party, this issue today is one of nonpartisanship. It doesn't matter whether you're a Democrat, Republican, Independent, or just politically agnostic. The issue of health care and taking care of our citizens, our state citizens, is important to everyone. And today marks April 15th. By the end of business today, Oklahoma citizens will have sent approximately $27 billion of our taxpayer dollars to the federal government. We come together as a community of Oklahoma citizens today and call upon our governor and our legislative leaders to just bring some of those $27 billion back to Oklahoma to take care of those people who desperately need health care in the state of Oklahoma. 1 out of every 5 of our citizens is uninsured. 1 out of every 5. Our hospitals, the entire statewide system on an annual basis, absorbs over $600 million of uncompensated care because of those uninsured individuals. We have asked the governor and legislative leaders to accept what would be approximately $8.2 billion worth of federal money to expand Medicaid to take care of nearly 200,000 of Oklahoma citizens. That's what we're here about today. I'm here to talk about the economics of it. Other folks will talk about the personal side of accepting these federal dollars for Medicaid, and others will even talk about what it means to the actual institutions, our healthcare institutions. But just on the economic side of things, it makes economic sense to accept federal dollars for Medicaid expansion. And here's why. The governor has offered up this year a plan to cut the income tax by 1/4%. She says that by giving back $120 million into the economic engine that is the people of Oklahoma, and what works out to $1.4 billion over a decade, that we'll see exponential growth in the economy. If $1.4 billion over a decade will help our economy grow, Governor Fallin, what would $8.2 billion do given directly to one of the largest economic engines in the state of Oklahoma, the healthcare industry? We believe that this makes economic sense for the people of Oklahoma. But what happens if we don't? What happens if we don't accept these federal dollars for Medicaid? It means bad things for not only our citizens who are uninsured, nearly 200,000 of whom will continue to go uninsured. It also means bad things for our businesses. Our Oklahoma businesses stand to lose $52.6 million if we do not accept federal money. Our hospitals, many of whom are represented here today, will lose significant money. Just a few examples. St. John's in Tulsa. Failure to accept federal dollars means that they will lose $153 million. Hillcrest, the Hillcrest community in Oklahoma stands to lose $237 million. Integris, Mays County, a much smaller county, but nevertheless they stand to lose $7 million. Holdenville, $3.6 million. Muskogee, $66 million to these rural community hospitals, whether they be urban or rural, the theme is the same. They stand to lose millions. In fact, the entire system, the entire hospital system stands to lose $2.9 billion if we fail to expand and accept federal dollars for Medicaid. It just makes economic sense. It's the right thing to do for Oklahoma. It's the right thing to do for our citizens, for our hospitals, for our doctors, and as well as for our businesses.
When a political decision is made and it impacts all those amongst us, the underserved and the uninsured are our neighbors. These are people we worship with. We see them at PTA meetings. You see them at the grocery store. But the repercussions for not having preventive care and access to affordable health care, it's just hard to explain how it trickles down. And for those of you that have known me, I've always said since I've been elected that sick children can't earn or learn, and sick people can't earn. To have the best workforce possible, we need a healthy workforce. And this is our money. I say this isn't Washington money coming to us or federal money. This is money that belongs to us. If it doesn't come back to Oklahoma, to make a bigger safety net, create a bigger safety net for those amongst us who don't have access to affordable health care, someone else is going to get the money. So I fail to see, with all the flexibility put in place, how we can say no. And it reminds me of planting a tree. Many of us you see up here will not be here in 2 years or 4 years. But when we plant a tree, none of us ever expect to sit in the shade of that tree. This is an opportunity with affordable health care and the ACA for us to bring to Oklahoma for future generations to have access to health. As you know, if you wait till you're sick, it's going to cost a lot more money. If you have access to health care all the way through your life, your whole lifespan, you're going to have a healthier workforce, a healthier community, and a better Oklahoma. And that's why I'm still wordless when it comes to the fact that Oklahoma hasn't decided how we're going to move forward. And I'm hoping that we'll have, before the end of session, a better resolution for all of our neighbors and all of our communities.
Hearing the numbers and hearing the moral argument, I wish I could speak more to that, loving numbers and loving just knowing the data. But what I want to convey in a very short time frame is our just very personal story that's unique to my wife and I. A couple years ago, I guess 7 years now, my daughter was born. It was an unremarkable birth, but later, very shortly, she fell into a coma and was later diagnosed with a disease, and this is an awesome name to try and write down. It's called non-ketotic hyperglycemia, or it's also called by the medical community glycine encephalopathy. It's a terrible disorder. Not a lot of people have it, so it's something that there's not active research or anything like that. Based on her receiving that diagnosis, we were given worst case scenario, like a 3 or 4 week time for her to live. Best case scenario was about 6 or 7 months. So we, after wiping the tears from our eyes and trying to scramble together a game plan moving forward, we started therapy, and through therapy we learned about Tefra and Sooner Care, enrolled in that, and we're people of faith and we believe in sovereign God, so we want to give him a lot of credit for her living 7 years, but we also want to give credit to the incredible therapists and doctors and nurses that nurtured her and helped us along the way. Through that, we believe there's a direct, let me back up and say, there's a direct link to her living 7 years instead of 7 months because we received Medicaid dollars. We have friends in other states who have a very similar daughter or son that has a very similar presentation of this disorder, and they're not doing very well because they're not actively in therapy and they're not receiving the kinds of assistance. And I'm not just talking about doctors and therapists, but I'm also talking about therapeutic equipment, wheelchairs, things like that, that if we were not able to receive assistance to procure those for our daughter, she would not have learned to crawl, she would not have learned to walk. So for us, and we may just be one family speaking, but for us it is an invaluable resource that the state of Oklahoma provided to us. And to follow that up, we recently, 13 months ago, we had another daughter, and she was born with the same disorder. So Ellie Kate is 7 and will always be 7 because she passed in December. But Lucy is going to walk down the same trail and going to have the same pitfalls and problems that Ellie Kate did. But we believe that if we can receive even the same amount of funding, if we can receive the same amount of assistance from the state of Oklahoma, then she'll not have a 13 or 17 month expiration. She'll have a 7 or 8 or 10 year time. And I know expiration wasn't the right word, but it's something that I guess personally, there's no way I can tell you how invaluable and immeasurable and personal Medicaid is to us. And expanding it, we believe, have been told that expanding Medicaid will ensure that Sooner Care receives the funding that it needs. So if that's the case, we're all for expanding because we want not just us, but everyone that's in similar situations as us that have children that have catastrophic illnesses and catastrophic problems in front of them. If they don't receive the funding, they're going to wither into the margins, and we want to make sure that children aren't just left to the margins, that they can survive and thrive.
There's an old adage in healthcare, and again, I've been in healthcare for 30 years, so it's a very old adage. Show me a community that loses its hospital, and I'll show you a dying community. I live in an area of southeastern Oklahoma where there are other hospitals around McAllister that are teetering on the edge. These hospitals serve Medicaid patients. These hospitals gave up a lot in concessions with the federal government in anticipation and an expectation to get funding and expansion of Medicaid, which has not happened. Now again, that old adage back then was about the economics of hospitals, but it's taken on a bigger meaning now. So show me a hospital that doesn't get Medicaid expansion, and I'll show you a community that can't serve its people. McAllister alone sees 2,200 plus or minus people without insurance in our emergency room. They could have insurance. Many of our hospitals see a majority of Medicaid patients, and without the expansion, may cease to exist. That doesn't make economic sense, and it doesn't make good community sense. And it's something that we need to look at, take seriously, and to provide good care to our communities, and to maintain primary care access. We need to expand Medicaid.
For those of you who are not familiar with Variety Care, it's what's called a federally qualified health center, or most people just refer to as a community health center. And they are significant in the services they provide to provide for the underserved and the uninsured in Oklahoma. I also do some volunteer work for the free clinic associations in Oklahoma and Oklahoma City. And I tell you, that experience working at a federally qualified health center and with free clinics has taken this from somewhat of a perhaps theoretical or philosophical question to a very visceral question for me. When you sit with patients in clinics now that are uninsured, that come to free clinics for their services, and you cannot provide what they need. You know what they need, but because they do not have the insurance card that gets them into the system, they go without. And that's very difficult to swallow, and I hope we can do something about that. This is a very difficult issue. I understand that. My previous position at the State Health Department, I understand costs of services and everything that comes with that. However, at the end of the day, to me, this becomes, as many people have said, this is a moral and ethical issue. It is the morally and ethically right thing to do, to strive to provide health care to as many Oklahomans as is absolutely possible. Other people in the world do it, other states in the union do it, and we should be able to do it also. One of the most significant problems with our healthcare system, and there are many, is that it is not equitably distributed. If you have the insurance card, you can get great care, without a doubt. We have the most sophisticated, technically advanced healthcare system in the world. But if you don't have the card, then you're in for a different experience. And I think many people have spoken to that, many people have experienced that here, and we need to change that. So it's morally and ethically the right thing to do, but I think that also increasing insurance coverage for our population can help us address many of the chronic health problems that have plagued us for many years. And many of you have heard me talk about those in the past. I would just say, just this year, there has been another study that's been released by the Commonwealth Fund, and then in which they started looking at communities and how the communities themselves provided care. And they refer to those as hospital referral regions. And there's 3 hospital referral regions in Oklahoma. Tulsa is the eastern third of the state. The Lawton Hospital Referral Region is the very southwest part of the state, and Oklahoma City takes up the rest of the state. There's 306 hospital referral regions in the United States, and Tulsa is 281, Lawton is 286, and Oklahoma City is 296 out of 306. So again, we rank at the bottom of most things related to not just health outcomes, but healthcare delivery and the quality of healthcare. Now we have to ask ourselves why that is. Why does Oklahoma rank so poorly? And I will just give you those numbers, but let me just give you to close with the summary of this study and what it says: local health system performance. Local health system performance is linked across all dimensions with better access to care associated with higher quality of care and better outcomes. The interconnectedness underscores the need for health insurance, payment, and delivery system reforms to improve care experiences and outcomes. Success at the local level will ultimately depend on communities and providers aided by strong leadership and collaboration, setting goals and taking action to achieve them. And I certainly hope we have the will and the insight and the courage to do that and move Oklahoma out of the bottom of many of these rankings which we've experienced for so long.
Serving as Secretary of the House Native American Caucus, along with our Chair, Representative Stacia Pittman, from the beginning of session on, we've looked at legislative ways to bring the state to a place where the state contracts out with tribes to capture more of these federal dollars for coverage of said Native Americans here in our state. We know that we have 52 tribal clinics, 6 tribal hospitals, and that accepting the federal dollars would actually allow us to double the potential of those who are covered up to 40,000 persons. This would be 100% federal dollars. Again, no cost to the state. That's also our federal dollars as Oklahomans, our federal dollars as tribal members. Last but not least, this is a unique population that's actually spelled out and above all documents the U.S. Constitution. And it's allowing us the opportunity as those who are elected on behalf of our communities to uphold what's called the federal trust responsibility. And Brother Archie Mason could talk on that more in another time. But I think we all know that when we take care of each other in this state, in the past we look at examples of that, it's where we've done the best. And this is another opportunity for that. I think we also have a really neat chance to build up the healthcare workforce associated with many of the tribal communities. So that's a local benefit instantly. We also have here with us Ed Romo, and is with the League of Latin Advocates. Specifically, just want to note that of the Native American population, we also have a large Hispanic population here in Oklahoma, and from our conversations earlier, you've got about a third of the population that's uninsured. So acceptance of federal dollars, coverage there would be a great benefit to the state.
Uninsured touch every corner of this state, and we are ready and we stand ready to make sure that we are helping solve the problems of this state and help our citizens. The House leadership has an opportunity to help, and I just wanted to point out a couple of things that I think it's important. And we have taken time out just to look at the median incomes and hopefully speak directly to the House leadership today, because they would affect their communities greatly by expanding Medicaid. A couple of the counties that I've pointed out, it's no coincidence that they're going to be members of the leadership in this building. We have Representative Jackson. The median income of Garfield County is $41,000. 27% of his county are already on Sooner Care. Another one, we have Tulsa County. The median income in Tulsa County is $47,005. Watson, Jordan, and Peterson, 25.5% of their county is already on Sooner Care. We have Speaker Shannon. The income level, the median income level is $45,947. 23% of his constituents are already on Sooner Care. By expanding and raising the qualification level to 138% of the federal poverty level, it will help Oklahomans and it will save lives. It's not an urban problem, it's not a rural problem, it's an Oklahoma problem that we can fix today. But we're willing to work with the House leadership, the governor, and others to help Oklahomans, and there's still time.
One of the leading arguments against accepting federal dollars for Medicaid is that we need to allow that money to stay in Washington. We don't need that money here. It is blatantly hypocritical for any leader in the state of Oklahoma to look at the people of Oklahoma and say we don't want to accept federal dollars for health care when we already accept as a state over $3 billion for Medicaid alone. For Medicaid alone, we already accept $3 billion. We accept over $600 million in federal money for education. We accept billions of dollars annually for roads and bridges. And I'd bet significant amounts of money that no leader in the state of Oklahoma would say, let's give $3 billion of that Medicaid money back. Let's give all $600 million of that money back from the federal government for education. Let's give all those billions of dollars back for roads and bridges, because the leaders of Oklahoma know, when you just talk about the policy side of the issue, they know that infrastructure, education, and healthcare are the three most important aspects of our community. And this Medicaid expansion will ensure that the health care of our citizens will continue to improve and not erode. We believe the governor made her decision not to accept the federal dollars for Medicaid based upon politics. And so our responsibility here is to not only educate our leaders that we work with side by side, but also to educate the public, educate our constituents, her constituents, so that hopefully the politics of this issue will change. When the people of Oklahoma realize, whether they live in McAllister or Holdenville or Tulsa or Oklahoma City, when they realize the negative effect that failing to accept Medicaid dollars will have on their communities, hopefully at that point they'll put the pressure on the governor to say we have to expand Medicaid, and that's part of why we're here today.